Working in a rural environment has allowed me to have a more hands-on approach to my training. I feel like I'm less of a paper pusher. It's been nice to spend some time actually seeing patients.
So I work as a rural generalist trainee, a GP registrar. This is a new pathway that we are trying to curate for rural generalists to maximize exposure not only to emergency medicine but also to palliative care, anesthetics, inpatient medicine, and basically to acquire multi-skills that's required for a rural generalist practice. I have great teachers here, and I think regional communities and rural communities are where more workforce is needed, so I'm very happy to become one of those. Yeah,
I was the first one to have John Flynn rotation with the hospital. It was very cool. I had it with Panacea just in town, and actually it was a very good experience. It's a new rotation with the hospital, between the hospital and Panacea. I was having a very good supervisor, like he's a GB there, supervising me every day, like how I'm doing, and rotating me over like all the GBs.
We're also trying to increase our capacity to train for the junior doctors who are looking at doing what is now called the Associate Obstetric program, which used to be called the DRANZCOG. Most people, they're probably in about their second or third year would look at doing it. So it takes a minimum of 6 months to do with us. We are a smaller unit, and so they get much more involved with the other GPs, so they're working much more independently than what they would if they were down in Metro. It's about growing our own, and very much because they're part of our team with the GPs, they're learning from those GP obstetricians that they are then going to go on and join that team. You're not competing with other people, so you're more likely to get your births there, that you're more likely to get your hands on for instruments. There is also always the support, that everyone is always around by phone call, and we understand that people are junior.
I am currently on the GP training program through RACGP. I am hoping to spend some or all of that time rurally. I often like going to the SCARP GP, which is a Friday morning breakfast, and the teaching's really great. Like, they get visiting specialists or local specialists who are really passionate about what they do, and it's for the GPs in town and medical students. The team are very supportive, always taking on feedback, trying to support you in any way that they possibly can. I feel more connected in Geraldton than I do in the city, which is really nice.
We were supposed to have 1-2 years in and then go to like Perth, but everything changed and we bought a house here, we settled down. So it wasn't our plan actually in the beginning. I found there is a lot of activities in Geraldton. I have 7-year-old son and 4-year-old daughter. He's playing soccer, swimming and karate. And my daughter is swimming and gymnastics. So actually it's like the weekend is quite busy with the training.
I love the ocean. I've grown up watching the ocean, so I like to see it in the morning, I like to see it in the evening. I love it.
It's really good work-life balance here. I live 7 minutes from the hospital, so it frees up a lot of time. I think I worked out that I'm saving about 9 hours each week in commute time. So that's 9 hours more surfing or yoga or running or just hanging out with friends. I can surf most days before work. I like to run. There's a few trail runs around in Geraldton. There's a lot of staff from the hospital that spend time together, and everyone sort of intermingles. Yeah, it's a very social town, and you never feel lonely.
I loved the geography, I loved the people, and I really fell in love with this place. I think it's great for a young family, and it's working well for us.
I would say go for it, because these opportunities aren't that common. There's a real misconception that you have to go to the city to get this training. So I think it really is about opening your eyes.
I love my work and I love my life outside of work, and I can do both at the same time.